So what exactly is OSHA? The Occupational Safety and Health Administration Act began in 1970. It is designed to protect the employees. Everyone in your office is going to want to know where important supplies and information are kept. In the beginning of your OSHA book, there is a page called OSHA Program Site Specific Information. On there, you're going to list your practice name, the safety coordinator, where your OSHA manual is kept, also the SDS sheets, where your spill kit is located, where the eye wash station is at, where your first aid kit or crash cart is at, and several other things like where the nearest hospital is at and where your fire extinguisher is located, and any emergency numbers as well. Go ahead and you want to fill that sheet out. Make sure it's updated once a year. In Section 1 of your OSHA binder, you will see it discusses bloodborne pathogens. Dentists, dental hygienists, dental assistants, and sterilization techs are at risk. Sometimes it's even argued that receptionists are at risk too. The most significant bloodborne pathogens are hepatitis B, hepatitis C, and HIV. Common symptoms of these bloodborne pathogens are hepatitis B is jaundice, hepatitis C is severe fatigue, and HIV would be swollen lymph nodes. Bloodborne pathogens thrive only in blood and other certain bodily fluids. There are 3 different types of routes of entry when it comes to being exposed to bloodborne pathogens: dermal, ingestion, or inhalation. If you have an open wound on your skin and you are exposed to a bloodborne pathogen, it can be contracted that way. If you eat something or you inhale something, it can be contracted that way as well. So what do we do to protect ourselves? We use standard precaution, which means we treat everyone as if they're infected. We always wear our PPE, which is personal protective equipment. At the minimum, we should be wearing our goggles, our masks, our gloves, and our lab jackets. When putting on your PPE, you'll want to take note of the following requirements. You'll want your uniform or your lab jacket to cover your torso from your neck to your knees. You want it to be long sleeves, so it goes all the way to the end of your wrists. You want your mask to fit tight. Press the adjustable side of the mask to fit securely on the bridge of your nose, and then pull the bottom of the mask to cover underneath your chin. Your goggles should fit snug as well. And when you put your gloves on, you want to pull them all the way back so they cover the cuff of your uniform so that no skin is showing. When taking off your PPE, you'll want to go in the following order, which will help limit self-contamination. First your gloves, then your goggles, then uniform, followed by any hair covers or any shoe covers, and lastly your mask. You will want to make sure you have new PPE for every patient. Once all your PPE is removed, you'll need to either wash your hands or apply hand sanitizer. If your hands are not visibly soiled, you can use hand sanitizer. The times that you do need to wash your hands are in the morning when you first come in, before you go to lunch, after you come back from lunch, and before you go home. And then also, if your hands are visibly soiled after a procedure. When you are washing your hands, you'll need to make sure you lather and scrub for at least 20 seconds. And don't forget to wash between your fingers, under your nails, and the tops of your hands. Please follow this diagram when washing your hands. To eliminate the spread of pathogens, it is required that all uniforms are laundered in the office or by a laundry service company. And any dental shoes worn in the dental office need to stay at the dental office as well. OSHA is all about documentation. Document, document, document. Regarding the things we just discussed, the bloodborne pathogen and your PPE, there are things you need to document for that as well. Yearly, you need to go over and sign the annual bloodborne pathogen exposure control plan. and also review your PPE hazard assessment. It is required that the hepatitis B vaccination is offered to all employees. It does come in 3 doses. Your first day of injection is called 0 month. Then you get your second dose at 1 month, and your third dose comes at 6 months after the day of your first injection. In section 1 of your OSHA book on pages 23 and 24 are the hepatitis B vaccination records. You can sign them saying that you had them done and put down the dates you had them done. Or you can bring that form into the doctor and have the doctor fill out the days that they give you the injections. Or you can also decline to have the hepatitis vaccination done. This needs to be done for all employees. OSHA requires a Safer Sharps evaluation to be done yearly. In section 1 of your OSHA book, on pages 6 through 16, you will see the Safer Sharps evaluation pages. You need to find 2 devices to try out every year. You need to try the devices and decide if you like them and if they will help prevent any further injuries in the office. You need to fill out the form to see if you like them or if you don't and give reasons why. And after you are done, you have to fill out the Safer Sharps review conclusion. Here are 2 examples of Safer Sharp devices. One is the protector, which is to help recap your needles, and the other one is to help take off the blades from the scalpels. You will lay the blade of the scalpel into the blade removing device and then close it. Make sure it snaps so it closes tightly, and then just pull the scalpel out. Under the bloodborne pathogen section in your OSHA binder, on page 8, you will find the Sharps inventory log. You need to take log at least once a year of anything that is considered sharp. Anything that can puncture your skin and give possible injury needs to be listed on there. When working in a dental office, there are occupational risk factors. They include contact with infectious bodily fluids like broken skin or your mucous membranes. An example of mucous membranes are the inside of your mouth or your eyes, and also puncture wounds with used needles or any burrs, anything sharp that could cut your skin. If you ever experience a work-related injury, you need to take care of the situation immediately. If you have a bloodborne pathogen injury, like a needle stick, you will need to wash the infected area immediately with soap and water. Then contact your safety coordinator and seek medical attention at the designated clinic. Any other injury, like a slip and fall, again, contact your safety coordinator and then seek medical attention. In your office should be the exposure plan that states this and tells you who your safety coordinator is and what clinic is designated for you. In your OSHA binder, there are several work-related injury documents, like the Sharps injury log, 301 logs, and several others. However, according to the United States Department of Labor, as of January 1st, 2015, offices of dentists are partially exempt from doing this. The only time you have to fill these logs out is if an employee has a fatality, has inpatient hospitalization, an amputation, or a loss of an eye. When disinfecting an operatory, there are several things to keep in mind. For one, aerosol travels approximately 3 feet. However, if you have a fan on in your operatory, the aerosol travels everywhere. It is recommended that no fan is in the operatory. So when wiping your room, you want to wipe down every horizontal surface in anything that has been touched while treating the patient. Utility gloves must be worn when cleaning the operatory. If you use your disinfectant with gauze, the gauze actually breaks down the disinfectant. So an important thing to remember is to always keep your gauze soaked to make sure that it's working properly. A Sharps container needs to be in every room as well. and you must know the contact time of the disinfectant you are using. I know some popular ones that are used are Cavicide, which has a 2-minute contact time, and your Birex has a 10-minute contact time. This means that the surface is not fully disinfected until the contact time is up. When transferring instruments from your operatory to the sterilization area, it is required that you either use a tray cover or put your instruments in a cassette when transferring them. This will eliminate any injuries if someone was to trip and fall. When you are in sterilization, you'll want to take note of the following. You must always wear your utility gloves. This will help prevent injuries. Your sterilized packages do not expire. The reason for dating the bags is if a spore test fails, you know what date to go back to when re-sterilizing. You cannot bend sterilization pouch past the perforated line. It does not get an accurate seal otherwise, and the steam does not properly sterilize the instruments inside. You must always let the statums or autoclaves dry fully. Pores on packages close completely during the drying cycle to ensure proper sterilization. Proper disposal is always a question in the dental office. If you have any used or faulty needles, they always go in the red sharps container. Dental anesthetic carpels are a bit different. If the carpel is empty and there is no visible blood, it can be placed in the garbage. However, some dental offices prefer that they always go in the sharps container. If the carpel has any visible blood, then it must go in the sharps container. But if the carpel has any anesthetic remaining but no blood, then it needs to be placed in the blue pharmaceutical waste container. Extracted teeth, if there's no amalgam in the tooth, then it needs to be placed in the red sharps container or a red bag waste. And if there is amalgam in the tooth, then it needs to be placed in a hazardous waste bucket, which is black. Under additional resources in your OSHA binder, on pages 35 through 38, you will see the biomedical waste section. There is a biomedical waste policy that needs to be filled out as well. Every dental office needs to have a business that is able to come pick up any hazardous waste or any sharps containers, everything like that. If you can please put a contract that you have, a copy of it, in the OSHA binder, that is a great idea. Also, wherever these wastes are kept, they need to have a sign on the door that says biohazard. There are a few things within sterilization that need to be done that are required by OSHA. One thing is testing your statums weekly. Neighborhood Dental mostly uses the confirm strips. Inside there are 2 control strips. You'll place 1 strip on the bottom and 1 strip on top if using an M11. If you have a Statum 5000, you'll place 1 strip in front and 1 strip in back of the cassette. Once sterilization is complete, you'll take the tested strips and send them off to confirm. They do send you weekly results. A monthly thing that needs to be done is testing your ultrasonic. You will take tin foil and wrap it around a rubber dam frame and stick it in the ultrasonic solution for about 5 minutes. Once it's done, take it out and you should see dimples or even perforations in the tin foil. This shows that your ultrasonic is functioning properly. Another thing is testing your cold sterile. There are different brands on the market. Here is shown the Metri test. You will dip the little strip in there, and when it comes out, you'll want to see that it's about a fuchsia pink. That will show that your glutaraldehyde is functioning properly. Waterline maintenance in a dental office is very, very important. You are required to clean all dental unit water lines at least once a week. Some common cleaners are the Minta-Clean and the Citracel. Each different cleaner has its own instructions, so make sure you follow them properly. It is highly recommended that you test dental unit water lines annually. You get little vials sent to you and you put a little bit of water in each line and it's each test tube, and then you send those test tube vials off to a company to have your water line tested. In Section 2 of your OSHA binder, you will find the Workplace Hazard Assessment. This needs to be updated yearly. It'll list different hazards and you need to check if they apply to your office or not. If they do, you need to write down the controls that are in place. If there are any issues with this hazard, you need to write down suggested control or comments on how to fix the problem and then get things taken care of. The following year, when you review your hazard assessment, you should see that it is taken care of. Section 2 of your OSHA binder discusses radiation safety. This yellow sticker shows, it says, warning, this X-ray unit may be dangerous to patient and operator unless proper exposure factors and procedures are observed. There needs to be this displayed on every dental X-ray unit. Some manufacturers include this warning statement. Those that do not, you need to purchase these stickers through Henry Schein and to place them on the unit. Also, lead aprons need to be hanging, not folded. It could bend the lead and break it. Lead aprons do need to be available in every office, even if your dental X-ray equipment states that the X-ray radiation level is safe. A thing that's an option or required in some states and recommended in others is the dosimetry badges, which monitor radiation that is received while working in the dental office. Currently, South Dakota does not require them. In Section 3 of your OSHA binder, you will have to review the Injury and Illness Prevention Program. Also in that Section 3 is the Safety Committee. Some states do require a Safety Committee and some do not. For an example, South Dakota does not require it, however, Nebraska does. You'll just need to list your practice name, your safety coordinator, and any other pertinent information on that. You'll need to make sure it stays up to date as well. In Section 3 of your OSHA binder, you will see the Emergency Action Plan. This needs to be filled out and evaluated yearly. On the Emergency Action Plan, you will see things like, where are your fire extinguishers located? Where is your designated meeting place, like if there's a fire in your office? What do you do in case of that fire? And then how about a tornado? It is highly recommended to have these emergency evacuation plans posted in every operatory. And what is required is to have these lighted exit signs posted as well. Every dental office is required to have a fire extinguisher. Everyone needs to know where they're located. They need to be checked monthly. To do that, you're going to check to see where the little needle is at, and it needs to be in the green area. You will take out the fire extinguisher and tip it upside down slowly, and then put it back. This is to make sure that everything isn't settling on the bottom. Also, your fire extinguisher needs to be inspected yearly by a professional. After they inspect it, they'll put a tag on there so you know when to call back next year. They're making sure that everything is functioning properly in case you would ever need it. Also, when you are doing your monthly checking, make sure you document that. Again, anything you do for OSHA, make sure it's documented and kept in a file. When using a fire extinguisher, remember PASS. It's the acronym: Pull, Aim, Squeeze, Sweep. You'll want to have the sign posted as well above your fire extinguisher. In Section 4 of your OSHA binder, you will find the Hazard Communication Program. You need to update the Workplace Hazardous Chemical List yearly. Also, anything, whether it's a chemical or a powder, anything outside its normal manufacturer container needs to be labeled properly. As you see, this Cavicide container here is labeled properly with a hazard label using the Hazard Rating Index cards. Safety data sheets, also known as SDS sheets, give information about a certain product. SDS sheets need to be accessible at all times. Neighborhood Dental uses a company called 3E, which allows us to reach any SDS sheets we need by calling the 1-800 listed there. These posters should be posted in every office so everyone can see them and then they know where they're at all times. Also, we get a contract from the company 3E. This should be kept in your OSHA binder. A new thing on the SDS sheets are the pictograms, which are shown below. These are to help you understand the product better. Every dental office is required to have a spill kit. The spill kit needs to be able to clean up chemicals, bodily fluids, and mercury. Everyone needs to know where the spill kit is located, and it's advised to put a sign on the door or wherever it's kept. The spill kit must contain at least the following items: absorbent, PPE, which include a face shield, gown, and gloves, a small broom and dustpan, bags for disposal, paper towels for cleaning, and a disinfectant. Every dental office needs at least one eye wash station. The following are criteria that need to accompany your eye wash station. It needs to be hands-free and able to run for at least 15 consecutive minutes. The water temperature needs to be between 60 and 100 degrees Fahrenheit, and it needs to be located 10 seconds from any potential hazard area. It also needs to be ANSI approved. Your eye wash station needs to be checked at least once a week. To do this, you'll just turn the eye wash station on and let it run for 5 consecutive minutes. Once you are done, make sure you document. There is a little checklist in the OSHA book that you can use, or you can make your own, but just make sure you keep the documentation on file. Ergonomics is always the beast in a dental office. When lifting items, you want to bend your knees and lift with your legs. Keep your back straight. If you're working at a computer, have the computer screen at eye level about 20 to 28 inches away from your head. Your shoulders should be relaxed when typing. You can use an ergonomic keyboard and also a headset for a telephone. When treating patients, you want to position your body in your chair so you are not bending over them. Have your back straight. Use fulcrums and do daily exercises with your wrists and fingers. When lifting patients in the dental office, it's required to use a gait belt. An office can request that a healthcare worker or family member help patient when going to the bathroom or transferring patient from car to waiting room. Our office is responsible for transferring patient from wheelchair to patient chair. The only requirement we have is to use the gait belt. We are not required to have a lift or any other mechanism. If the patient does require the need for any additional help besides a gait belt, we have to refer them out. When using a gait belt, slide it behind the patient and wrap it around the front. You'll want it to fit right below the chest and the abdomen area. There are 2 loops. Slide the belt through the first loop and then through the second loop. Once you have it through the loops, pull tightly on the belt so it fits the patient tight. You'll want to tuck the tail between the belt and the patient so it's not dangling down. You will then help the patient adjust their legs to the floor. Ask them if they are okay and make sure they are not dizzy. You will put one leg in between both of their legs and grab each side of the belt with both hands and help them stand up. Again, make sure they are not dizzy. Grab the back of the belt and help them walk. In Section 6 of your OSHA binder, it discusses workplace violence, which is defined as violent acts, whether it's including physical assaults or threats of assaults, toward any person at work or on duty. This can include patients or employees. You need to analyze what your office's greatest threats are, whether it's waiting times, billing and copays, drug seekers, and so on. Discuss the controls and see if there's any changes that need to be made. What would you do if there was a workplace violence situation? In Section 7 of your OSHA binder, it discusses respiratory and tuberculosis. On page 5 in Section 7, you'll have a tuberculosis worksheet that you will have to fill out and assess if you are in a high risk or a low risk area to being exposed to TB. Tuberculosis is a respiratory disease. Some common symptoms are cough lasting more than 3 weeks, coughing up blood, night sweats, and unexplained fever. If you are in a low-risk area, your office is not required to do TB skin testing on employees. However, if you're in a high-risk area, it is required to do TB testing annually. If you have a patient that has suspected tuberculosis, you do not see them. Send them straight to the hospital. TB treatment is anywhere from 6 to 18 months. Under additional resources in your OSHA binder, on pages 2 and 3, you will see the comprehensive OSHA compliance checklist. You will need to go through this and make sure your office is in check with everything on here. OSHA training is required to be done once a year. You can do a large training all at once, or you can section out different material and do smaller trainings over the year. Every time a training is done, you need to document it and keep that on file for 3 years in each employee's file. Every dental office is required to keep an employee medical file for any employee who is at risk for occupational exposure to bloodborne pathogens. The file must be maintained for duration of employment plus 30 years if the employment lasts longer than 12 months. However, if the employment is less than 12 months, then the file can be given to the employee at the time of termination. The files must be kept confidential, and they must include the employee's name, Social Security number, job title, Hep B vaccination documentation, and any exposure records. This concludes our OSHA in a nutshell training. If you have any further questions or concern, please see your safety coordinator. Thank you.